I was experiencing blood in my stool for a couple of months, and the particular type of cancer is very slow growing, so those polyps must have been there for a while. And I hadn't had a colonoscopy, foolishly probably.
Everyone should have a colonoscopy at the latest by age 50. I mean, that's routine screening. And some people need to have it earlier based off of family history or if they have symptoms. In Mr. Goyer's case, if he had had his routine colonoscopy at the age of 50, it's possible that we could have prevented him from getting rectal cancer, or at least diagnosed it earlier.
Cancer was in my lymph nodes, and that qualified me for stage 3. And I'll be honest with you, I was scared.
Fortunately, when he did start having symptoms, he had rectal bleeding. Too many people ignore that, just assume it's something like hemorrhoids. In fact, most symptoms that people have on their bottom, they assume are hemorrhoids. You're probably aware most people aren't at their cocktail party talking about their bottom, so there's a lot of misinformation about the anal and rectal area.
That was the scariest thing about it. I had no side effects whatsoever. No, nothing. It led me to believe that I was sick in any way.
So when he did start having the symptoms with the bleeding, he finally went to his physician, and eventually I was called in and performed a colonoscopy. We did find on him a rectal cancer that was already advanced to a stage 3. Now he's 10 years later, disease-free and considered a cure from his rectal cancer.
I've had a happy life and a gift. I've been blessed in so many ways that I guess that having a great surgeon just kind of fit in, you know. It's foolish not to do the prescribed test and screening for it, because it's a vicious cancer once it gets hold. Dr. Gregorcyk really went the extra mile for me.